Unique case presentation, intertrochanteric fracture, presented by Matilda Wadier. A 40-year-old male patient came in for X-ray of the femur. After taking patient medical history, he said he had a motorbike accident a week ago and broke his proximal femur. They did a surgery on him a day after the accident, so he was just coming for a follow-up to see the alignment of the femur. He came in on July 5th. That means the accident occurred ending of June. He also said this accident has occurred twice within 8 months and injured the same leg. He came in with a walker, so we asked him how much weight he can put on, and he said the doctor told him no more than 50 pounds. So we decided we're not going to make him do too much of flexion and adduction. Again, the wound was fresh and he was in so much pain. We did 4 views of the femur: upper and lower AP, upper and lower lateral femur. We did cross-stable lateral for the distal part and regular lateral proximal. The tech tried to do the proximal part of the regular way, but the patient couldn't. This is the AP, proximal, and lateral proximal. By comparing the lateral with the AP, there is no difference. As you can see, it's the same, not so much difference. And this is the AP distal, and this is the cross-stable lateral. The radiologist report states that there is a comminuted fracture at the intertrochanter. According to Spine Health, a comminuted fracture is a break or splinter of the bone into more than 2 fragments, since considerable force and energy is required to fragment bone. Fractures of this degree occur after high-impact trauma, such as vehicle accident. The report also stated that no misalignment seen. So this is the fracture of the intertrochanter right here, so multiple fracture of it. They have intermedullary rod and nail. According to Medscape, they are means of fracture fixation in which a long metallic implant is inserted at one of a long bone through medullary canal. The rods are simply cylinders. These are the rods. They are simply cylinders that are thinner and more flexible than nails. The nails are more rigid implants. These are the nails, and these are the rod. So the nails are more rigid implants, usually have proximal and distal holes for interlocking, and causes more pain to the knee. The nail was popular in 1970s and 1980s. This type of treatment led to excessive external rotation and knee pain, and it has been abolished, this type of nail implant. Also, the rod, the length of the intermedullary rod will depend on where the fracture has occurred. They pull long when the fracture is on the shaft and short when the fracture is on the head. So as you can see on my radiographs, the rod comes all the way to the knee. So that means the fracture was occurred on in between the shaft and then the head of the femur. That's why they put the long rod to stable for the treatment of the fracture. These are the screws just to hold the implant stable. These are another screw, and these. So as you can see, these are the openings. The stitches they did is still there, so that shows how this case was new. The reason why I chose this case was that the way the tech did the proximal lateral. The tech tried to let him do as much as he could to attack the leg. You will injure it more when you do that, when you do the frog leg for the proximal femur. If I was to be the tech, I would have done the Daniela's method for the proximal part, even though it was a femur and not hip, just to avoid extra injury because the other leg was okay to move. So the Daniela's would have been the perfect way to get the lateral view of the proximal. This type of case, it will also be important to analyze the patient condition and decide the type of procedures to use. It was also important because, as you can see, this rod or the implant is so long, so I was confused why they used the long, because all that I was saying was short ones. So I decided to choose this case to learn more from, to do more research and know more about it. So that's the reason why I chose this case. Thank you. Bye bye. And this is my citation for the case.